iPrevent viewers! Thanks for tuning in to this month's YouTube video to learn about how you can take care of your health. Our topic this month is cervical health, since January is Cervical Health Awareness Month. Now, this is most likely a topic you haven't thought about, especially if you're a young person. You might not even know what a cervix is, but don't worry, I'm here to help. First, we're going to talk about what a cervix is.
If your biological sex is female, then you have a cervix. As you can see from this diagram, the cervix connects the vagina to the uterus. The cervix is mostly made up of muscular tissue, and it's the part of the female anatomy that opens during childbirth. But it's responsible for more than that. It also allows the passage of menstrual fluid during a woman's period and the passage of sperm the other direction so that a woman can get pregnant. And when someone is pregnant, the cervix helps protect the growing embryo, which lives in the uterus, by acting like a plug from the outside environment.
So cervixes play a pretty important role in female reproductive health, but they are also vulnerable to different health conditions. This is why Cervical Health Awareness Month exists, to educate people with cervixes about how to take control of their cervical health early and often.
One of the greatest threats to cervical health is cervical cancer. An estimated 13,800 women will be diagnosed with cervical cancer this year. But there are things we can do to lower the risk of developing cervical cancer. Number 1, get your HPV vaccine.
HPV, also known as human papillomavirus, is a virus that is transmitted by oral, anal, or vaginal sex that is responsible for almost all cases of cervical cancer. Both women and men can get infected with HPV, and it can resolve on its own, but if it doesn't, it could cause cervical cancer in women. There are actually many different types of HPV, but the vaccine protects against the kinds that can cause cervical cancer.
The HPV vaccine, which is approved by the Food and Drug Administration, is called Gardasil 9 and is recommended to preteens ages 11 to 12, but can be given to kids as young as 9 or adults as old as 26. It is not recommended to get the HPV vaccine above the age of 26. It is a 2-dose vaccine, which means you get one shot and then another 6 months later. After that, you are protected from HPV.
If you have not yet been vaccinated, iPrevent encourages you to talk to your doctor or contact us at 504-418-4955 and we can schedule you a clinic visit to talk about your vaccination options.
Another important way to prevent yourself from developing cervical cancer is to get a regular pap smear.
So let's talk about it. What is a pap smear? I know there was a long period in my life when I would hear people talk about pap smears and just pretend that I knew what it was, but I actually had no idea. So let me explain. A pap smear is when a doctor looks at the cervix and gently scrapes cells from it that are then sent to a lab to be examined for anything that looks not normal or could be an early sign of cervical cancer.
It's recommended that anyone with a uterus gets their first pap smear at age 21. If this test looks normal, then you can wait 3 years before getting another pap smear. If there's something that doesn't look quite right, the doctor could recommend that you come back more often. Even if you have had the HPV vaccine, experts recommend you still keep this pap smear schedule to make sure you're staying on top of your cervical health. Cervical cancer can be difficult to catch early because it shows little symptoms until it starts to spread in the body. If you want to get a pap smear but aren't sure where to go or if you can afford it, there are many community health clinics in the New Orleans area that offer these services. Clinics where you can get a free or low-cost pap smear include St. Thomas Community Health Center, Planned Parenthood, Noella Community Health Center, Crescent Care, and Luke's House Clinic, to name a few.
Although pap smears are not 100% accurate, pre-cancer cells can take years to develop into cervical cancer. So getting pap smears as recommended should detect cervical cancer early enough to treat it. In fact, due to pap smears, cervical cancer cases have decreased significantly in the past 40 years. Cancer is scary, but you can protect yourself and lower your risk of cervical cancer by getting the HPV vaccine and regular screenings as recommended by healthcare professionals. Cervix Health is in your hands.
Thank you for tuning in to hear about Cervical Health Awareness Month, iPrevent viewers. If you have any more questions or want to be connected to more resources, iPrevent wants to help. DM us on social media at iPrevent_OHL or call us at 504-418-4955.
We also offer free condoms and lube, HIV and Hep C testing, and can schedule a clinic visit for you. We are here to help you. See you next time.